Hi there, I'm Dr. Jacob Kneeman, double board certified in pain medicine and physical medicine, and if your shoulder pain keeps you up at nighttime, you're definitely not alone. Up to 67% of people with shoulder pain say it gets worse when they sleep. Research also shows that poor sleep increases pain sensitivity the next day. This creates a vicious cycle that many people struggle with for months or even years. I hear this all the time in clinic that my patients can deal with the pain during the day, but that nights are destroying their quality of life. With stress on the rise, more people sleeping in awkward positions, shoulder pain at night is more common than ever. Please tap the like button below and stick around until the end so that I can show you the top 3 sleeping positions that consistently help my patients get real relief. So let's break down the 3 best sleeping positions for your shoulder. I felt that really sharing my bedroom life with where my pillows were, my bed, was just a little intrusive. So what I'm going to do is I'm going to use this pillow here to illustrate when needed. Now let's dive right in. If you're a back sleeper, what I recommend is sleeping on your back with your arms supported. So it looks like this. Place your pillow under your elbow and forearm, just not under your hand. So it kind of looks like this. So in this situation, think of the pillow like a shelf holding your arm in a neutral, relaxed position. Of course, you're laying down on your back, so it's not exactly what you look like in bed. But just imagine the pillow sitting underneath the forearm and the wrist, supporting the arm. And the idea is that it's reducing the downward pull of the shoulder muscles that often causes night pain. Now, I had a patient who went from waking up 6 times a night to sleeping all the way through the night, just using this simple setup. If you have pain on both shoulders, of course, you can feel free to use it on both sides. Research shows that muscle support reduces nighttime shoulder pressure. So a simple thing you can try is just support the elbow and the forearm so then the shoulder can relax. But again, don't put anything underneath the shoulder itself. All right, this next one is for those of you who sleep on your side. If you do, hugging a pillow can make a huge difference. This position gently opens the shoulder joint and prevents it from collapsing forward. I usually recommend using a firm pillow that supports your arm from elbow to the wrist. Just imagine hugging a large teddy bear pillow that keeps your shoulder aligned and protected, just like this. A viewer and patient told me that this was the first time she slept more than 4 hours without waking up in pain. Frozen shoulder especially benefits from supported forward flexion of the shoulder during sleep. So what does that mean? So think about it. When you hug a pillow, you're actually bringing your shoulder joint forward, right? So that's forward flexion. So that actually takes a lot of tension and pressure off your shoulder. So what you can do is keep the arm supported and avoid letting it collapse forward. And again, this is one of my favorite positions because I'm typically a side sleeper and I don't really know what to do with my arms during that time. I don't really know what to do with my arms when I'm on my side and they're just splayed out like this. It's much more comfortable grabbing a pillow and hugging it. Now, the next one is if you are a back sleeper, but say you have other issues and you want to sleep in a more reclined position. So sleeping slightly upright, so I'll demonstrate this to you now. So you're kind of leaned back against some pillows in bed, right? It's pretty self-explanatory. So this reduces shoulder strain and decreases swelling. Many people naturally discover they actually sleep better in a recliner during flare-ups. And actually, if you have back pain, you'll really know that you sleep better in a recliner. But anyway, let's get back to the shoulder. This position relaxes the shoulder by reducing gravity's pull on the joint. I had a patient who slept in a recliner for 3 weeks and had 50% less morning pain thereafter. It's not that you have to do these or use these positions forever or, indefinitely. Maybe if your shoulder pain flares, you can just do it for a couple weeks or so and then go back to how you were before. Again, elevated sleeping can reduce pain sensitivity by improving circulation at nighttime as well. So what you can do if this position appeals to you is use 2 to 3 pillows to create kind of a gentle incline and support basically your elbow as well. If one of these positions sounds like something you want to try tonight, tap the like button so this reaches someone else losing sleep over their shoulder pain. And please, please, please comment which position has helped you the most, because your story can help someone actually feel better. Now, what you can do tonight is to choose the right position that feels most natural to you. You'll already have a sense of what you need to do, whether you're a back sleeper, a side sleeper, etc. It does not need to be perfect. It only needs to just reduce pressure on your shoulder. Again, one of the themes is to support the arm from elbow to wrist. This just decreases the tension on the shoulder and is a good way to keep the joint neutral. Next off, I'll say that it is really important to avoid sleeping directly on the painful shoulder. We know that even short periods of direct pressure can actually inflame the tissues. Another thing you can try is to add a small pillow behind your shoulder blade. This actually reduces forward rounding and relieves pressure immediately. Again, this is a little bit difficult to show on the video, but if your shoulder blade is here, you're basically putting a little bit of pressure where my hand is. So that way it kind of pushes your chest forward and takes more pressure off your shoulder joint. And again, another thing you can do is to improve your sleep routine in general. Research shows that poor sleep increases next day pain, regardless of whether it's your shoulder, your hip, your knee, or your back. Even one night of better sleep can noticeably reduce pain levels. Remember, your shoulder is not broken. Night pain can feel scary, but again, it's a mechanical problem, it's reversible, and there is something you can do about it. With the right position, you can sleep deeply again. If this helped you understand your shoulder pain better, hit subscribe so you do not miss the next video if you're interested in more pain-related conditions explained in a simple manner. And comment below which shoulder topic, or really any pain topic, you want next so I can make a video that helps you directly. Thanks again, and I'll see you in the next one.